Good morning, everybody, and thanks so much for joining us here on KXAN Live. I'm Will Dupree, coming to you from the KXAN Live studio on this Thursday. We are going to go to Austin City Council in just a moment, where several council members are holding a news conference ahead of their scheduled meeting today. What they're going to discuss is the Fight Back for Reproductive Health Agenda that Council Member Vanessa Fuentes has introduced. It's a series of resolutions that she says that is needed because of the Supreme Court's potential overturning of Roe v. Wade, which provides a federal right to abortion. Again, we are awaiting those remarks here in just a moment. We have a breakdown of what the series of resolutions would do over on our website. One of them includes providing free menstrual products at city-owned facilities, but Councilmember Fuentes, who is there at the lectern at the moment, will describe what these resolutions will do, her intent behind them, and then we'll provide some counter perspective on this after the news conference. But we want to take a listen as this begins again at Austin City Council. So let's go now to Councilmember Vanessa Fuentes introducing these remarks.
Yes, awesome. Thank you. Good morning. Good morning, everyone. Good morning. I'm Vanessa Fuentes, Austin City Councilwoman representing District 2. I'm here today with the mayor, my colleagues, Councilmember Alter, Councilmember Vela, and Councilmember Madison, as well as State Representative Donna Howard, and many advocates are joining us today to talk about 3 important reproductive justice policy items that Council will be voting on later today. I firmly believe that each of us should be able to live, work, and make decisions about our future and our health with dignity and economic security. In order for every person to control their reproductive lives, they must live free from discrimination on the basis of their reproductive health needs and decisions about where they live and work. What I'm bringing forward today is a policy that will prevent discrimination based on a person's reproductive health decision. In light of the recent leak of the U.S. Supreme Court opinion that has been weighing heavily on the hearts of many, and on the 1-year anniversary of when Senate Bill 8 was passed at the legislature last year, my first proposed policy will make our stance loud and clear that Austin will always fight for the health, safety, and personal medical decisions of our residents. An explicit protection against employment and housing discrimination based on reproductive health decisions is needed now more than ever, because we know that no one should have to worry about losing their job or their housing because of health care decisions. Without a doubt, the imminent reversal of Roe v. Wade will have devastating impacts on our community. We know that nearly 1 in 4 women will have an abortion in their life. And as state and national entities continue to encroach and restrict reproductive freedom, it is our responsibility here at the local level to defend reproductive rights. And while the City of Austin is poised to be the first city in Texas to update our non-discrimination ordinance, I know that we're not the only ones working on it, and that soon additional cities will follow suit. In tandem with my resolution, I'm also bringing forward a policy to provide free tampons and period products in city-owned facilities like libraries, recreation centers, as well as our showers and bathrooms accessible to people experiencing homelessness. The average woman has her period for nearly 7 years and will spend close to $18,000 on purchasing menstrual products throughout our lives. And which, by the way, the state of Texas still charges sales tax for period products. And I know Representative Howard has legislation that would change that. So we're hoping that that gets passed. In order for women and people who menstruate to participate fully and equally in society, menstrual hygiene products must be safe, they must be accessible, and they must be available to all who need them. And so that we're bringing that forward because we're about to, next week is the Global Awareness Day for Menstrual Equity, Menstrual Hygiene Awareness Day, and it is a global movement to normalize menstruation. And so this is a part of that effort as well, and my colleague, Councilmember Madison, will share a lot more about the experiences that our communities have. Lastly, while we've seen reproductive rights chipped away at the state and federal level, we as a city are committed to using our legislative power and to ensure that all Austinites have the freedom to control our own bodies, to safely care for our families, and to live with dignity. With all that is stacked against us, it may feel like there's little that we can do to combat the attacks on abortion access. Yet we, as City Council members, have a unique opportunity to mitigate a hostile climate and ensure that we are thinking of innovative ways to advance reproductive freedom. As elected officials so closely connected to our communities and our residents' struggles and needs, we are well positioned to implement innovative new policies focused on health, focused on safety, and focused on the economic security of our families. With that, I do want to give my thanks and gratitude to Council Members Vela, Ellis, Poole, Mayor Pro Tem Alter, and Mayor Adler for co-sponsoring item 88, which is the one regarding reproductive health decisions in our non-discrimination ordinance. And I'd also like to thank Council Members Ellis, Kitchen, Tovo, Harper Madison, Mayor Pro Tem Alter for co-sponsoring item 89 regarding access equity in menstrual products. With that, I will turn it over to our mayor, who will share some remarks on item 35.
Councilmember Fuentes, thank you for picking up the laboring oar and helping to lead on this issue. Always proud to stand up with my colleagues and our champion in the Texas legislature, Representative. Thank you again for being with us. You know, I believe that reproductive justice means protecting the human right for all people to decide to have children or not to have children, as well as the right of parents to be able to parent our children according to our wishes. Our state leadership is trying to take away basic rights and to take over for parents. The series of resolutions on today's City Council agenda seek to preserve those rights and to protect and show respect for Texas families. With the leak of the draft Supreme Court decision highlighting the risks we face here in Texas, these resolutions take on additional meaning. For example, family building by means of tools such as in vitro fertilization may face limitations in Texas as a result of the Texas legislature and the Supreme Court's reckless and radical overturning of judicial precedent establishing the right to privacy and bodily autonomy. In vitro fertilization has not been the focus of the discussion, but make no mistake about it, it is just one of what I fear will be too many casualties that will probably come from this radical step backwards. Several weeks ago, I announced that we would be drafting what is now resolution number 35 on today's agenda, following from the work that was earlier done by Council Member Fuentes and co-sponsors on the council, because I recognize that families are built in many different ways, but not all of those ways are supported by our policies and our programs. Employers can and should do more to support couples and individuals who choose to start a family and to normalize the prioritization of caregiving when those families are formed. This includes individuals that have been diagnosed with infertility or anticipate that condition because of a treatment for cancer or other illness, or because they're single or they're in a same-sex relationship. Right now, medical assistance or the ability to preserve fertility options is only accessible to those with the resources to pay out of pocket. Individuals and couples that are desperate to start families can find themselves in the impossible choice between the cost of treatment or adoption, and it can impact how many resources can be dedicated to early childhood care. The emotional and physical toll of social infertility should not be intensified by the financial burden that can come with treatment or services that are needed by a family. And it is my hope that other employers will follow what I hope to be the lead taken by the City of Austin advancing these workforce equity policies, and specifically the life-changing family-building benefits for in vitro fertilization, adoption, and fostering. And beyond Austin, we are also advocating for these protections at the federal level. And I filed a resolution to be considered by the United States Conference of Mayors here in just 2 weeks, encouraging broader adoption of these policies nationally. I am proud to stand with my colleagues on the City Council, with advocates from across Austin in support of the full spectrum of reproductive justice, the choice to say yes, the choice to say no, and the choice to say not now. These bills help Austinites exercise those rights. Proud to stand with my colleagues and my sponsors on these measures. Thank you.
Thank you, Mayor. Wonderful. Thank you so much, Mayor. And next we will have Councilmember Vela.
Thank you all for being here, and thank you to Councilmember Fuentes for sponsoring these two items, fighting for reproductive rights in this critical time. The lead Supreme Court decision in Roe v. Wade has galvanized those of us who value human rights. The right to privacy stems from Roe v. Wade and is a bedrock of so many of our cherished rights. The right to contraception, the right to an abortion, the rights of LGBT folks to marry or even just love whoever you want, all stem from the privacy guarantees contained in Roe v. Wade. If Roe v. Wade falls, all those rights are threatened. As an attorney who very much values civil rights and human rights, it's deeply troubling to be facing that possibility. I'm saddened that we have to stand up here today defending people from discrimination based on their medical and reproductive decisions. These are private issues that should have nothing to do with your government, your housing, or your employment. The prospect of facing civil lawsuits based on your reproductive choices is awful enough. But to know that a month from now, abortion seekers and providers could face first-degree felony charges, that is truly horrific. Austin residents, please know that we are searching for any way we can to defend you from this attack on your human rights. Councilmember Fuentes, thank you again for initiating these crucial protection measures. I'm completely in support of these items.
Thank you, Councilmember Vela. And next we will have Councilmember Harper-Madison.
Good morning, everybody. My name is Natasha Harper-Madison. I'm the proud council member for District 1, that's East and Northeast Austin. My other colleagues and I are here today to basically face a fact. To face a fact that just over half of the human population does or will menstruate. It's a bodily function that is natural and normal, as natural and normal as sneezing, breathing, blinking, or going to the bathroom. Yet, because of a way outdated traditions, it's completely stigmatized in our culture. This stigma does actually do harm to real people, and as usual, it's lower income people who suffer the most. Period products cost money, and I'll go off script just a little bit here and tell you how I came to being a part of this conversation. I have the great opportunity to have multiple income-restricted housing complexes within a very close proximity to one another. And I like to visit the laundry room because that's where people spill the tea. And so I was in the laundry room having a conversation, and somebody said loosies. I don't know if y'all know what the term loosies mean. Normally when they say loosies, they're talking about selling a loose cigarette. And they generally say so in cities like Baltimore and New York. People are talking about buying loosies in reference to tampons, maxi pads, and diapers. That means somebody goes to the store and breaks open a package of tampons, maxi pads, or diapers and sells them one at a time. That was a clear and distinct reminder to me that it is very expensive to be poor. It is very expensive to be poor and purchase the things that you absolutely need. It is very expensive to be poor and purchase the things that you absolutely need. I want y'all to look up on your own. I don't want to give you statistics. I want you to make the investment on your own to figure out how many days and productivity of education, active education, and work that women and girls miss because of a lack of access to menstruation products. It's real, and it affects everything, our GDP and everything else. So I want folks to do some research on their own, and other than destigmatizing the fact that women and girls do in fact menstruate, I want you to recognize that your peers, people who are just like you in every other way physiologically, with the exception of the fact that they do in fact menstruate, are at a disadvantage. I'll go on. People who can't afford menstrual products, they suffer more of the embarrassment and more of the inconvenience of that lack of access. They miss school, they miss work, they miss other important engagements, and they put their own health at risk by using homemade solutions. For somebody to share with me, I said, when you don't have access, what do you do? And she shared with me, and some folks will think this is crass, but I'm going to tell you the honest to God truth. She said she cuts up old t-shirts. The capital city in the great state of Texas, the 11th largest city in the nation, she cuts up old t-shirts. I want y'all to let that sink in. There's a growing movement to end the stigma and to do more to expand awareness and accessibility. There are people who are pushing to snap cover period products. They're fighting an upside-down system where the price of period products includes a sales tax. I'm happy to know that my colleagues are working actively against that. But the price of over-the-counter male libido boosters doesn't have a similar tax. And I'm proud that our Majority Woman Council is a part of this particular movement. This has been an issue that has been a priority for me since I came into office, and we have a resolution before us, thanks to my colleague, Council Member Fuentes. We really appreciate you bringing this forward, that builds on a pilot that I set up with the Austin Public Health Department and the Austin Diaper Bank just last year. And I have to say that as I was approaching the conversation, I was pleased to recognize that our Commission for Women had already been working on the project for years prior to me bringing it to their attention. I didn't, in fact, bring it to their attention. I just joined the conversation. That program delivered more than 130,000 period products to low-income Austinites across the span of 6 months. According to a survey, nearly half of the recipients said that they had trouble buying period products each month. The next time you go to the CVS or the HEB, I want you to make your way down the aisle and take a look at what that expense is. Even if you don't need them, just take a look. Take it into consideration what people might be spending. The 6-month pilot also helped nearly 3 out of 4 recipients to attend school or go to work. So we know that there's a need in our city, and we know that it's simply expanding, and access is simply expanding, and we need to get results. I appreciate Councilmember Fuentes for bringing today's resolution forward, and I look forward to wholeheartedly voting to approve it. We have to end the stigma. We have to end it today. And we have to stand up for reproductive rights and for reproductive health. I appreciate everybody who's paying attention this morning, and I really, truly, I encourage you, I implore you to invest the time that it takes to recognize the importance of the subject matter. It's not just about half of the population, it's about all of us. Thank you.
Thank you, Councilmember Harper-Madison. Next, we have a representative from the Menstrual Equity Coalition, Pritka Paramasvian.
Hello everyone, my name is Pritika Parmasivan and I'm a student at the University of Texas at Austin. I am a proud co-founder and organizer with the Texas Menstrual Equity Coalition. I would like to start by thanking Councilmember Vanessa Fuentes and Councilmember Natasha Harper-Madison for their efforts in addressing all of the reproductive health inequities and systemic barriers that inhibit menstrual equity to flourish at the local level. Additionally, I would also like to thank fellow co-founder and organizer Andrea Elizondo for leading this initiative and bringing this into the eyes of both our organization and to the council members. So to begin, I wanted to introduce a little bit about the Texas Menstrual Equity Coalition. The coalition is a Texas-based organization led by people all across Texas to advocate for equity in reproductive health for all. Many different coalition members organize and lead local organizations dedicated to the cause in their respective cities all across Texas, and we serve as a coalition to build power and community and advocate civically among each other. Menstrual equity, to define it, is the affordability, accessibility, and safety of menstrual products. Several states in the United States have successfully abolished the tampon tax. However, as we stand today in Texas, that is not the case. We hope that we can make this happen in Texas and have advocated in the past legislative session to make this progress, but have not seen the effects that we want, and we'll continue to pursue this action as well. But I believe that it's very important to understand that menstrual equity is not just about products. It is not just about being able to access these menstrual products, but it's also about the education and reproductive care that comes along with being menstrually equitable. In the light of the recent news that we have heard with the leaked draft and the threat placed on the accessibility for fundamental reproductive rights, such as abortions and Plan B and sexual education, I think it's very important to understand that people across the United States have not only fear about their lack in reproductive health, but their lack in accessing different critical educational aspects such as menstrual equity. So in this light, along with the Textual and Menstrual Equity Coalition, I strongly urge the City of Austin to take proactive steps in decreasing reproductive health inequities by providing free menstrual products in all City of Austin locations. Thank you.
Thank you so much. All right, and our last speaker for today, we have a representative with Jane's Due Process, Roseanne Maripuram.
Good morning, everyone. My name is Roseanne Maria Purim. I use she, her pronouns, and I am the Executive Director at Jane's Due Process. Jane's Due Process is a statewide organization that helps anyone who's under 18 access birth control and abortion care confidentially. Jane's Due Process is also the recipient of the City of Austin's grant for practical support services for abortion, along with Fund Texas Choice. Today, I am so proud to be here in support of these resolutions and policy items to support reproductive health, including menstrual equity. I have to say the honest truth, which is that it has been a devastating past 9 months in Texas for abortion access. Abortion rates for adults seeking care in Texas dropped by 50% in September of 2021. And for youth, it dropped by 70 to 90%. That means that people are not getting abortion care in Texas. That is why when we heard about the leaked Supreme Court draft, we were so concerned, and also now I'm so proud to live in a city that's going to push back and fight for reproductive freedom. The reality is that for those who can travel, it's incredibly expensive, and in some ways the expense itself stops them from traveling. For example, we work with organizations like Fund Texas Choice, which 99% of its clients are going out of state, and it's costing thousands of dollars to drive or fly to other states. And as we face a future where Roe v. Wade may be overturned, it's not just crossing one state line, it's crossing several. This is not the future that we deserve, nor is it a true iteration of what people believe in our country or in Texas. The majority of Texans support abortion care. They support the right to reproductive choice and freedom. Today's resolutions are an important step forward by our city to affirm the right to reproductive freedom, including abortion care and access to menstrual equity products. I'm so grateful to all of our lawmakers who are standing with us today and all the advocates who have fought so hard for this, but this is just the beginning, and we deserve true freedom, including abortion access.
Thank you. And we do have one more speaker. We have Kristin Harry, who's going to share her abortion story.
Have you ever felt a life and a spirit grow inside of you? Have you ever felt a strong spirit from that life grow deep inside your body, then slowly fade away until there's nothing left but yourself? I have. I've had to care for another child whose birthday is just a few days after our due date. They were supposed to be like sisters. When my husband and I got pregnant, we knew there'd be a huge possibility of a miscarriage because of my chronic illness, but we never expected to be lied to by medical physicians. I was lied to by my doctors, insisting my hemorrhage at 13 weeks was normal, we were healthy, and there was nothing to worry about. I found out by another doctor on the last day of week 19 that our daughter had multiple fetal abnormalities, giving her a 1% chance of survival. I was at risk of infection due to internal bleeding, and I was developing placenta previa. My husband and I had no choice. Our daughter was dying inside of me because the body that had been created for her was incompatible with her spirit. She couldn't survive in that body, and by forcing her to, I could lose my life as well. The only choice we had was to let her go in peace so we could create a healthy body for her spirit to live in. No one should have to be forced to live just to die in pain. In my womb was where she was created, and she will return one day. It's been 4 years since the loss of our daughter, and due to the trauma of going through all of the anti-abortion laws, we have been too terrified to try again. What if I once again get out healthy and hemorrhage at 13 weeks when there's a ban on maternal health at just 6 weeks? I'd have to drive out of state just to get health care. I'm sharing my story because there are mothers like mine with stories like mine, but the only difference is they didn't have the privilege of their family sending them thousands of dollars like mine had done for me. Mothers like Rosie Jimenez have died and can't be here to explain they needed to use abortion care on their unhealthy pregnancies. Healthcare procedures might hurt your feelings, but you need to rise above your sensitivities and realize that abortion care comes in many forms, but it is always health care. Thank you.
Thank you for sharing your story. Okay, we have time just for a few questions, and then I believe council members and advocates will be available for individual interviews. Any questions? Okay, well, thank you all so much for joining us today. I really appreciate it. Thank you.
Thanks for sticking with us here on KXAN Live. Will Dupree coming to you from the KXAN Live studio again. We wrapped up that news conference there from Austin City Hall, where council members are discussing a series of resolutions they're going to vote on today at their meeting. One would provide free menstrual products at some city-owned facilities. Another resolution would make reproductive decisions a part of the anti-discrimination ordinance that the city has. We, again, will follow those votes today and report out the results as soon as we can. We should point out that many anti-abortion activists are championing the draft Supreme Court decision that came out that would overturn Roe v. Wade because it says that furthers their efforts to be able to protect unborn children. We, again, will follow what happens at Austin City Council meeting today, so please stay with us as we report on that. Additionally, you should expect hot temperatures today, as you see out there looking from the Austonian next to me. It is a pretty day, but it's going to get much warmer. We do have rain chances in the forecast. You can find information about that on our website. That is certainly welcome news for me and a lot of you out there, so we want to share those details with you as soon as you want to check them out. They're available on KXAN.com. Thank you all again for watching. I'm Will Dupree in the KXAN Live studio. We'll see you back here throughout the day with other updates, so please stay with us. Hope you all stay safe out there and take care.